Hi, I'm Sorrentino, also known as CombatCounselor. This is the second in a series of videos that I'm doing, otherwise known as CombatCounselor Q&A. And this week I'm going to focus on what you can do as a client to get the best therapist possible when you do decide to go out and seek therapy. Because not all therapists are alike. Many people seek the expertise and advice of professionals, paying top dollar for what they believe is psychotherapy. I've been a licensed psychotherapist for over 20 years, having seen literally hundreds of clients, but very few ever asked me about my qualifications. Of course, I am legally obligated, morally and ethically as well, to inform my clients about my education, experience, licenses, and approach to treatment, legally known as informed consent. And I do so consistently. However, there are multitudes of individuals and groups out there advertising themselves as therapists, life coaches, healers, and other creative titles, hoping the public, you, will believe that they are qualified to help you with your psychological baggage. Client, beware. This is the first series in which I will take some of the mystique away from psychotherapy. Many people understand therapy based on what they've seen in movies, on HBO or A&E, and books, on TV, for example Dr. Phil, and have no idea what goes on behind closed doors. My goal is to help you understand what psychotherapy is and is not, so you can make an informed decision about whom you can trust with your deepest, darkest secrets, and pay hundreds, if not thousands of dollars to in the process. The purpose of this series, this particular series, is to inform you about who is qualified to provide psychotherapy and who, in my opinion, is not. At the most basic level, there are specific requirements in each state for practicing psychotherapy, and therapists are regulated by the state in which they practice. There's a governing body for each specialty, for example, licensed professional counselors, social workers, psychologists, and psychiatrists, which specifies requirements to practice in that state. And we, the therapists, are required to meet those requirements prior to seeing a single client. For example, a licensed professional counselor, like myself in the state of Missouri, is required to hold a master's degree from an accredited institution with an emphasis in 10 core areas: counseling theory, human development, diversity, testing, and so on. Completing a supervised practicum and internship, as well as 3,000 hours over a 2-year period of supervision under a qualified licensed clinician or therapist, psychologist, psychiatrist, counselor, doesn't matter. Additionally, an LPC, like myself, must take and pass a national counselor examination, an extremely difficult, comprehensive nationwide exam, in addition to passing a background check to make sure we are not murderers, child molesters, or rapists. Only then, if the board sees fit, do you receive a license to provide psychotherapy in the state. Most states have similar requirements for each profession, but some variation exists from state to state. You can check the requirements for each profession in your state by going to your state's website. In the case of Missouri, the Missouri Division of Professional Registration oversees licensure for all of the psychotherapy professions. You can find the requirements for yourself by visiting http://pr.mo.gov/default.asp. Which brings me into my next topic, the professions. Titles vary slightly from state to state, so I'll focus on Missouri guidelines to simplify the discussion. Again, you can check with your state's regulatory body for the specifics of the state in which you reside. In Missouri, individuals qualified and licensed to provide psychotherapy are called licensed professional counselors, LPC, licensed clinical social workers, LCSW, licensed psychologists, or psychiatrists. Let me briefly explain the differences between them. LPCs and LCSWs are master's level, normally 2-year post-baccalaureate degree clinicians having completed their graduate degree in the field of study in which they are getting licensed from an accredited institution, not a diploma mill. They have completed a supervised practicum internship in clinical supervision, 3,000 hours over 24 months usually, successfully passed the required national or state exams, and they must not be a felon. Remember that background check? This will be important later. And be approved by the state board governing their specialty. Finally, we are all professionally and ethically required, above all else, to do no harm and to protect your confidentiality. So what is the difference between an LPC or a licensed clinical social worker and a psychologist? A psychologist goes through an almost identical, if not more rigorous, qualification process, with the difference being that they have completed a doctoral program instead of a master's degree, normally consisting of 3 to 5 years of post-baccalaureate education in a school of psychology, in the case of a PhD, or the school of education in the case of a EDD, or Doctor of Education degree. There's also a professional school degree called a PsyD, a Doctor of Psychology, in which they can also become licensed. Doctoral level clinicians, beside the additional 1 to 3 years of school, have more coursework and experience in research design and psychological testing than most master's level clinicians do. Many people get psychologists and psychiatrists confused, and I often get the question, what's the difference? In a nutshell, psychiatrists are physicians, otherwise known as medical doctors or MDs, who have completed a 3 to 4 year specialization in psychiatry, whereas a psychologist calls him or herself doctor because they have a doctorate degree, but they cannot prescribe medicine. Psychiatrists are an excellent choice if you believe you need medicine, for example, antidepressants, mood stabilizers, antipsychotics, anti-anxiolytics, etc. But in most cases, and in my experience, have limited clinical experience. Think talk therapy like CBT, because they were trained using the medical model and believe drugs are the answer to most problems. More about that in a minute. It really does not matter whom you choose, an LPC, a licensed clinical social worker, a psychologist, a psychiatrist, as long as you can verify that they are licensed to practice in your state and you believe they can help you based on their individual training and expertise. Fees obviously vary between LPCs and LCSWs, with them being the least expensive in general, and psychiatrists being the most expensive, with psychologists falling somewhere in between. All things being equal, the most important things to consider are: A, does the clinician's approach make sense? B, is their approach compatible with your beliefs and values? And C, do you think you can get along with that person? Can you trust them? You might ask yourself, what's the difference between being licensed, for example, a licensed professional counselor, and being certified, for example, a national certified counselor, of which I am both. Licensure is a legal requirement mandated by a state. Certification is a process in which a governing body, sometimes a state, county, city, or even a private organization, in the case of the National Board of Certified Counselors, which develops requirements to give additional oversight and credibility to an individual profession. For example, I am required by the state of Missouri to be licensed as an LPC in order to provide psychotherapy to clients, but I have chosen to seek an additional certification through the National Board of Certified Counselors, also known as NBCC, which, by the way, requires an additional 100 hours of continuing education every 5 years. Each certifying body has their own requirements and processes, some very stringent, like NBCC, and others not so stringent, as I will highlight for you now. As I mentioned in the opening paragraph, there are many people, some well-meaning, some not, who call themselves therapists or something similar, making you believe they are qualified to help you with your psychological problems. Client beware. These individuals go by titles such as life coach, intuitive life coach, energy healer, psychic healer, hypnotist, spiritual counselor, the list goes on and on. There are individuals hosting radio shows and writing magazine columns, giving relationship and other advice to strangers with their only qualification having been married for a few years. Other examples are certified life coaches or spiritual counselors who take as few as 2 or 3 courses, sometimes less, and pay a few hundred to a few $1,000 or complete as few as 16 hours of training, sometimes even less, to get their certification. Some of these titles may sound impressive. What exactly is an intuitive life coach anyway? And lead you to believe the individual has received enough training to help you, but there is no state licensing body overseeing their practice, and no stringent internship or supervision requirement versus the 3,000 hours that licensed clinicians have to take. No continuing education requirement, and remember what I said earlier, no background check. Many of these individuals may have good intentions, please don't get me wrong, but do you really want to pay someone with 16 hours of training, hundreds or even thousands of dollars, confiding in them and sharing your deepest feelings and concerns? I know I do not. There are some properly trained and licensed professionals, counselors, social workers, psychologists, etc., who may use titles such as those described above, for example, hypnotist or life coach. Why they would do that, I'm not sure, but they do. The key difference being that these individuals have attained licensure in their state, completing the rigorous requirements defined by law. So when you decide you want help sorting out your problems, do not let titles or fancy names fool you, and make sure you ask as many questions as possible, do a little research, and ensure you hire someone qualified to give you the help you so richly deserve. Even among professionally licensed clinicians, there are good ones and bad ones, so make sure you understand the process, ask the right questions, and ensure you're getting what you're paying for: sound, professional assistance in helping you manage your life. Notice I did not say anything about advice, because if the individual is giving you advice, even a licensed professional, turn and run as fast as you can. More about that in a future article. I'm Chris Sorrentino, and this is Combat Counselor Q&A. If you have any questions, feel free to email me at kccbt@hotmail.com, or you can follow me on Twitter at Combat Counselor, or follow my blog. That's on Blogger. That's www.combatcounselor.blogspot.com. It's been a pleasure talking to you, and I'll be with you in the next week or two on a new topic. Thank you.